Hi, ladies. I am so excited to share this interview with you today. We have Dr. Chad here from NRG Physiotherapy, and he is just phenomenal. So I have known Chad for probably a year and a half or so, and a little background about how we met, because I think it's important to this interview, is we met as potential referral partners, business to business. And at the time, I was struggling with some hip discomfort and pain that had gotten really bad and was planning to have surgery. And when we met, um, Chad, the first question I asked him was, what's the difference between what, a physiotherapist does versus a sports physical therapist? Because I was seeing a physical therapist. And he said, well, why are you seeing him? And I kind of just shared a little bit about it. He asked me a couple questions, and he very forwardly said, well, I don't think you need surgery. And that is one of the things that I love about Chad. He's going to tell you like it is, which is definitely my kind of person. But long story short, I started working with Chad on mobility and strength, and really it just changed my life and gave me my running back, and I didn't have to have surgery. And so Chad is a gem, and he is going to tell you all about his journey and what to expect at the retreat. So thanks for being here today.
Thank you for having me.
You're welcome. Well, tell everybody just a little bit about how you kind of are in the space you're in today. So how you got into physiotherapy, how you thought that this was kind of the realm in which you wanted to make a difference in the world through your business, and just kind of share a little bit about that with the ladies.
Sure, yeah. So we'll give you a brief rundown, and then we'll make it pretty specific to running as we kind of move the conversation forward. But I got started in PT. I was actually building houses with my dad, and we built a house for a PT. And if we backtrack, probably maybe 5 or 6 years before that, my first encounters with PT were much like yours, Whitney, pretty underwhelming. And so sometimes I think back and I think, oh, it's a miracle I even landed up doing this gig because before PT school, I suffered with severe back pain, like super debilitating, couldn't lay down in any position, couldn't rest, couldn't sleep. And it was weird. It wasn't like typical stuff. It was like I could move and do things normally, but when I would lay down and relax, it would literally take my breath. Kind of a crazy phenomenon. And so I had, looking back now, then I was young and I couldn't really fully grasp the healthcare system and kind of this thing that I was moving through. But ultimately I knew I wasn't getting any results. So, I struggled with my back, had an incident with my shoulder. I've had multiple surgeries on my right ankle and multiple on my right knee. And all of this was kind of pre-PT school, and I struggled with this stuff for a long time. So really what pushed me into PT was, being totally honest, saw the lifestyle that this guy had that we were building the house for, and it was attractive. I always knew that I loved the sciences. I loved anatomy, biology. I really just didn't know what that looked like or what I was going to do with it. And that ultimately pushed me into health and human performance in undergrad. And then just through some conversations with this guy led me into PT, which was perfect. Even though I had a negative experience in PT initially, through more learning and going through PT school, it really fit kind of how my mind works and what I like to do, and really just kind of evolved from there. Once I got into PT school, I even worked with several of my professors. They couldn't figure out what was wrong with me as far as my back and shoulder were concerned. And so still pretty limited, but still trying to sort out the pieces. Blew my ACL in PT school, which, by the way, when you work at PT clinics and when you are in PT school, it's very difficult to get PT. So I had some pretty poor recoveries around my ankle and my knee, and which left me with a lot of residual things that I was trying to sort through and figure out. Ultimately, not able to find anybody who could progress me past where I was in any way that made sense to me. And then fast forward, out of PT school, maybe a year or two, I started figuring some things out just by treating lots of people in the in-network model. So if you hang around me long enough, you'll hear me really throw out some negativity towards insurance and the in-network model. But it wasn't all bad. I got to see a lot of patients. I got to correlate a lot of pain patterns with patient histories and patterns of joint limitations and muscle limitations, and ultimately allowed me to understand, based on what these people are telling me, what their pain is like, I can predict what their movement looks like. And ultimately we're tracing pain, orthopedic pain, back to the way people move. And then beyond that, we're tracing the way people move back to their lifestyle. So how are you spending the other 23 hours of your day? And so ultimately that in-network model, treating 4 patients an hour, 20 patients a day, up to 25 patients a day, I eventually became very uncomfortable with the quality of service that I could provide a human being. And that's what pushed me out into Energy Physio. Now, there really is no distinction between a physio and a PT. It's just a much cooler name, I think. But the real difference is being able to spend the time and take the time with a human being to understand where their deepest problems exist, and then also being able to take the time and put in the effort and the work to help them start to chip away at these problems at the deepest level, versus just covering up somebody's pain, making their pain go away at a very local site. And that's where Energy Physio takes the biggest shift, is away from treatments for symptoms, and we really move towards solutions for people's problems, which are a little more extensive than just therapeutic exercise or passive modalities or a little bit of manual therapy. It's a little more all-encompassing. What's your lifestyle look like? How are you spending your days? What are your movement and mobility practices? How can you integrate rehab and prehab and injury prevention into those things you're already doing? And ultimately, how can we set up routines to help you develop and maintain good functional movement and mobility through whatever your movement practice is? And so that's kind of how I got to here. There were a lot of factors in my personal life that sent me down a path of asking questions and looking for more and trying to develop a deeper understanding of how the whole human is knit together, versus just how does the shoulder itself function, or how does the low back itself function. And ultimately that's allowed me to advance my evaluations and diagnosis and treatment protocols beyond just these local sites into kind of this holistic aspect of the human being as far as movement mobility is concerned.
Yeah, thanks for sharing all that. And I think that's the biggest thing that I've learned working with you is that, you think like it's the shoulder or it's the knee or, but there's so many other things that surround all of that with your, daily activities, your mobility, all those pieces that come together that then that's only like the pain that's kind of like the like flashing light, right? And so it's like what's underneath that and how do we treat all that? And I think that's been one of the biggest just I think learning experiences for me, and also too like just the benefit of working with you is being able to look at that holistic picture. And I do that with clients. Why wouldn't we do that in a pain aspect too? So I think that's a
Sure.
really big piece of your work. And it's
And if
definitely,
you'll allow me to move over into your world a little bit, you'll hear me talk a lot about how negative the course through healthcare is. A lot of people, they have pain, which people have no beliefs about pain until they're given one. And so another big part is getting people past their current limiting beliefs and their limiting decisions about what their pain is. And that's why our current model is so detrimental to people. Is you go to see the doc and you have pain, and they immediately send you for an advanced image, and that image is inevitably going to show something, and then people develop a belief system around that image. And in what I do, I have to constantly deconstruct people's beliefs about their body and about what's going on. And just because this anatomy doesn't look textbook, that doesn't necessarily mean that's what the problem is. And once you can break down these mental barriers and limiting decisions about what your pain is and where it's coming from, then you can really start to come up with a good action plan for how are we going to manage this? What are the things we can control? What are the things we can improve? What aspects of my body do I have control over that I can change that aren't normal? And start to develop new movement patterns, kind of reconnecting the brain to how you move and what it feels like. Because people's beliefs drive their thoughts, they drive their feeling drives their actions, and their actions drive their results, and then their results kind of reiterate their belief. And
Yep.
until you can deconstruct that belief, it's really difficult to move people past what they've been told by the medical system and really get back to what's your body telling you, what are the things you can affect change on, and that's where you have to start. And so that's a big deal with being able to take time with people beyond, here's your pain, here's why it's painful, let's work on that. And then once you feel better, you're okay, and send them on their way.
Right.
And so, it dives past the physical realm a little bit into the realm of the mind, because
Mm-hmm.
a lot of people's pain and limitations exist in their mind. We just got to show them how to kind of break out of that and move their mind in a new direction to be able to allow their bodies to heal, start coming up with good plans to help move in the right direction.
Yeah. And that's why I love, that piece of your work too, because it's very in alignment with what I do with, runners, what I do with my clients, and, working on those limiting beliefs and what's holding them back from, getting the results that they want. And so, yeah, that's a fantastic piece of your work. Well, tell us a little bit about what, attendees who are coming to the Transcend Running Retreat, what they can expect from your, presence, because you're going to come and you're going to do a workshop, which I'm so excited and so blessed to have you. So tell them a little bit about just what they can expect to experience when they come.
Sure. Yeah. So what I find with runners, more than anything is, and it's not runners, it's human beings in general, is human beings think because they can move that they have the right to do so however they want. And it's simply not true. There are prereqs to movement that people need to avoid injury and be able to progress into whatever level of performance they want, without having setbacks and without having injuries that kind of drop people back. And almost anytime I talk to people, especially in kind of the zone of, man, I'm really ready to get back into some health and some fitness, I'm ready to dial my nutrition in, the first people think about doing is running. And so there's a lot of prerequisites for running that not only can help you run better and more efficiently, but also can rehab you out of an injury if you already have one and help you prevent future injuries. Just by implementing some very simple strategies around your running routine that can help you kind of minimize your risk of injury and move you in the direction you want to go. So what you can expect is from me always the cold hard truth. I'm gonna tell you some things that's probably gonna shock you. I won't give away all my secrets, but we're gonna talk everything, about running, from what type of mobility is required, how do you do it, when do you do it, when's the most time effective way to do certain things, but also about running form, running shoes, things around running that aren't running but are important for your running, like your lifestyle, your job, how you spend your day. Are you in your car? Do you have strategies to break out of your daily positions to get into a running position? And so there's going to be a large conversation around what is normal for the human versus what is common. Because you'll hear, oh, it's normal to only have this amount of range of motion when you're 35 years old. It's not normal, it's common. Functional movement is what it is. It demands what it demands, and there's no way around it. So we got to be able to understand, what are your targets for moving? Are you meeting those targets? And if not, how do you modify? How do you scale? How do you kind of rein things in so you can keep making progress without taking massive steps back? And so ultimately, by the end of the retreat, by the end of the workshop, you're going to get a little understanding of kind of where should my body be, just as far as how it exists in space. What is normal human movement? What concepts should I be thinking about in my normal daily life that are going to drive my running career forward? But then we're really going to hone in on, what is mobility? Why do we do it? What's it for? It's kind of this mobility 101 type of thing. And you're going to leave with some very simple strategies to implement before and after running to help you rehab if you need it, prehab if you don't,
Mm-hmm.
ultimately improve your running performance and efficiency, but then also treat your body right after you run, so you're not riding it hard and putting it up wet, so to speak.
Mm-hmm.
And the idea is how can we warm up in a way that preps your body for running and improves your functional movement? How can we run in a way that's efficient and efficient for the body, that minimizes stress as much as possible in the body? And then how can we cool the body back down and bring the body back to baseline in a way that leaves your tissues primed and ready for the next time, versus leaving your tissues cold and stiff with a lot of built up metabolic junk inside the muscle from a long run. And ultimately, that's really what's going to be the big takeaway. I'm going to give you some knowledge and wisdom and tidbits on things that are no doubt important, but I really want you to leave with something that is super tangible, super practical for your running, your warm up, your running, and your cool down routines to be able to feel better, move better, perform better. And then, of course, we're going to have to talk about strength and conditioning for the runner, why it's important. Runners like to run, and they think the only way to run faster or further is to run faster and further. So
Yeah.
we're going to break down some myths around running and running training programs and some of the kind of mentalities people have around running, and really just hopefully start to deconstruct those a little bit for you, so you can see that there are different ways that you can train and run and be effective and faster and run further without necessarily pounding the pavement more to get there. And ultimately, I think what you'll come away with are things that will make you feel better when you run day one, and then give you some targets that you can move to over the course of the next week, month, year, however long it is that you want to be doing this thing called running.
Yeah. And I think what's great about what you're going to be offering is that we are then going to be able to practice and implement these things at the retreat before our run. So once we kind of, learn all this from Dr. Chad and we experience, his information and wisdom and tidbits, that he's going to share with us, we're going to then be able to implement that before our runs and after our runs, after he's come. So that's a really big piece of it too. And it'll be a very eye-opening experience. It was for me, when I first met him, but it's really changed how I train athletes, and it's going to be a good time. So thanks so much, Chad, for being here. I know that your time is really valuable, but I wanted to thank you, and we're so excited to see you in September. Any last words of wisdom before we head out here?
Yeah. Don't do anything real goofy before the retreat. You're going to get a lot more out of it if you're not in some kind of wicked amount of pain. So be smart. I know Whitney's taken a lot of you guys through some weight training, some running programs. And so keep up with what you're doing. Stay healthy, stay strong, and I look forward to seeing everybody at the retreat.
All right. Well, thanks so much. And we'll see you guys later. Thanks, everyone.